We can also talk about some of our post-operative care. Typically after the procedure, again, you go home the same day, but we do ask that patients wear their compression stockings for approximately 2 weeks after the procedure to allow that vein to completely scar down after we've heated up on the inside of it. We do ask that patients walk as much as possible the day of the procedure to help the blood flow in the deep system continue to flow back towards the heart. Typically, we say that patients are okay to shower the day after the procedure, and then we ask that you not be underwater, a pool, or a bathtub for 2 weeks. We usually say that we wait at least a week before we do any kind of high impact or strenuous exercise or activity. And typically we say that, again, we want you to do some light activity. The strenuous activity we ask that you hold off for at least 7 days. We ask that patients stay hydrated with drinking plenty of water the day of the procedure and for a couple days afterwards. And then typically we do a follow-up ultrasound at about 48 hours to check for any potential complications. And so typically the things that we mention when we talk about postoperative complications or adverse events would be things like bruising, some mild swelling. Usually those are pretty minimal, and patients tolerate that quite well. The biggest thing that we always mention is potential cause for a deep vein thrombosis. That is fortunately less than 1%. It's very rare, but that is why we bring patients back for that 48-hour ultrasound to check to make sure we don't have any evidence of that complication. Some other potential treatment options that we have for these patients with varicose veins, typically after we do the ablation, so after we do that endovascular thermal ablation, if patients continue to have some visible ropey varicose veins that are right underneath the skin that are still causing either some discomfort or patients don't care for the looks of those, we can go in and do what's called a micro-stab phlebectomy. So this is completely different from the vein stripping. This is where we make very small little 2 to 3 millimeter skin incisions along the length of that varicosity and use a little vein hook to actually pull those small varicose veins out. Again, we do this under local anesthetic. Patients tolerate this quite well, and again, it is an outpatient office setting procedure. So here are some pictures that we have of patients, some before and after pictures to kind of demonstrate some of the changes that we can see in patients after they've had ablations, and some of these patients have also had the phlebectomies as well. Again, when Dr. Mina was talking, a lot of times patients think of these as cosmetic procedures, and really, even though the pictures are quite impressive, seeing the before and after pictures, the main thing that we like to see is that patients come back in telling us that their legs not only look better, but also feel much better. A couple other things that we do here at the Vein Center are some more of our cosmetic things. The mainstay would be sclerotherapy. That would be cosmetic procedures for those very small spider and reticular veins. Unfortunately, this is a cosmetic procedure, so insurance companies do not pay for this, but sometimes after we've done the radiofrequency ablation and sometimes that microstab phlebectomy, if we still have some of these small spider and reticular veins, we can go in and inject a polydocanol sclerosing agent into those small spider veins to get those to disappear. And we usually say that patients can expect about an 80 to 90% reduction in the appearance of those small spider and reticular veins. And again, here are some before and after pictures of the sclerotherapies. You can see on the picture on the left, the patient still has several spider veins and some of those slightly larger reticular veins. And then the after picture is approximately 6 months after, so it does take a little bit of time to get those to resolve, but pretty significant before and after results on those. And so again, in conclusion, we appreciate you watching our video and letting us tell you a little bit about some of the newer options that we have for helping patients with these venous reflux and varicose vein disease. Again, much different than the way we used to treat these, and having very good results with very minimal downtime, very minimal office procedures, and patients that are very happy with the results. So thank you so much for your time.